Hello everyone, my name is Jed from SynapseMedED. So today I will walk you through how to use our AI tutor, or just walk you through the learning modes of the AI tutor. Remember, I just got some learning modes. So I'll go ahead and go to the AI tutor. I'll collapse this. So if you're using a desktop or a laptop, I'll just say a laptop because desktop is something. If you're using the desktop version, if you click here, you can expand this. You can see your history. Earlier, today, and all that. And you can see your AI question bank if you have some questions that you have created. So now we have 4 learning modes. We have not 4 learning modes, sorry. We have 1, 2, 3, 4, 5 learning modes. Sorry, I'm going to add something. I think there'll be 6 learning modes soon. So we have the explanation mode where you ask anything, any medical topic, and then give you a topic in detail, and it's evidence-based. And we have the Socratic mode where you explore concepts through guided questions. So I'll just say, for example, help me understand hypertension. And it will search our knowledge base, the medical literature. Now, instead of it giving you everything that you need to know about hypertension, it will ask you questions. How would you define hypertension in your own words? And what do you already know about these, about how it's diagnosed? So that's how it works. The explanation mode, on the other hand, it works by giving you everything that you need to know about diabetes, for example, everything you need to know about all those things. And along with the quiz mode. The quiz mode, you can just say, for example, quiz me on, I'll just say, quiz me on cervical cancer, right? And I'll click enter. So it will start analyzing the literature, and then it will create a question for you, and it's interactive. That's the good thing. And once it's done finalizing the answer, it will give you the answer, the question. So probably it will give you what we high yield facts, where it just focuses on what's important according to the notes that we've added or according to the literature. Now, a 30-year-old gives you all those kind of things, and I'll just pick something random and look at it. I got it. Great. You can view the explanation here of all the answers. Excuse me. Then we have the discussion mode here. So here it's giving you some open-ended clinical reasoning with collaborative exploration of any topic that you want to study. So for example, I want to say, let's discuss an approach to acute chest pain. So a patient comes comes to OPD, or they present with acute chest pain. What do you want to know? What are the questions that you want to focus on? So it starts by asking you certain questions, a few questions to start our discussion. What are some of the first things that come into your mind, or that come to your mind when a patient presents with acute chest pain? What's your immediate priority, and what elements of history and physical exam do you find most crucial? Remember the Socrates. For those who are doing clinical rounds, that's what you know. How did it start? Where is it? All those kind of, the location and all that kind of things are things that you use. So when you give you those things, it might correct you and help you, right? So you're discussing with the AI. And then we have the deep research. So deep research is like you want to research more about, let's say, review evidence on tide versus liberal glycemic control in ICU patients after nice sugar. So it's research for you in the knowledge base, the medical literature. So, and then it gives you all the information that you need. It's a deeper research, so it gives you citations as well that you can actually kind of verify. So I urge you to click on the citation, verify the information before you just take the information blindly and use it elsewhere. But the thing is, it takes information from the trusted medical sources. It takes from like PubMed. I was about to use Shorner, PubMed, and all those kind of things, and it gives you all that information for you to use, right? So once it's done, it's going to be easy for you to just hover, and then you see all those things that you want to see. So these are the learning modes that we have so far. I've had many people saying, can you please put a virtual patient? It's no, guys, it's a process. So I'm going to work on the documentation on that, on how I'm going to integrate it, and I'm going to review the documentation, send it to a colleague who is going to also review the documentation. Then I can implement the idea or the feature. So let's see if it's done. It's not yet done. It's a lot of information. Let's just cut it and start a new feature. So some of the additional features that we added, we know that some people struggle with prompts. It's going to be it's difficult for some people to create a very effective prompt. So I came up with an idea, where we have the blueprint and the templates. The template is a quick way of starting. You just put disease. You want to study a complete disease, or you want to do a clinical feature focus, or you want to focus on the diagnosis deep dive. So if you click on the disease, all you have to do is to enter the disease and start learning. It will create everything that you need on the prompts. You want to study a drug? We got you. Complete drug review. It will have all the things that you need in there. Exam tip: you can actually create interactive MCQs. You can also do some clinical approach to clicking, to patient clicking. Let's do interactive questions. Let's say I want to do cervical cancer. Now I can start learning, and then it creates a prompt for me for 5 MCQs, and then I can just start. So it starts creating all those MCQs for me, and I can answer those MCQs, and I'll be able to retain some information about on those MCQs. And the good thing about these MCQs is I can share these MCQs with other members. So on the other video where we'll talk about the study spaces, I'll explain how to create MCQs using our AI and how to actually share those MCQs with your colleagues in a private session, study space, and you can actually be discussing on using threads, and you can actually plan for a discussion or a study session. So I'll just pick a random answer here that looked very nice. So here it's saying, which of the following is the most effective primary prevention strategy for cervical cancer? It's obviously the vaccination, the non-valent, the quadrivalent, all those kind of, the bivalent, all those vaccinations that are the primary things. So obviously when you go to the ward, they'll tell you, okay, you which age group do you do this, which blah 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 do you do this, and all that. So there's a 28-year-old woman who goes for a routine health checkup. So now the other feature that I forgot to mention is, let's say there's a word that you don't understand. Let's say I want to understand what's a pap test. So if I just highlight, if on the phone you just long click, you click explain, it explains the pap test for you. So there's no need for you to start a new chat. It just explains it for you right there. So a pap test or a pap smear is a screening procedure for cervical cancer. It involves collecting cells from the cervix to examine under a microscope for abnormalities, right? Stop, you got it. Now this is the AI, right? Obviously the history, you can have a separate place where you can actually look at the history. You can revisit the MCQs, and they'll be interactive even in the history, so that you can actually practice in the history and all that. And the other thing that I can also mention is with AI settings, you can choose what do you want this AI to do. Do you want a conversational, a friendly, engaging, and academic? So for me, I prefer it on the clinical, practical, and concise mode. I prefer, because I'm doing clinical. You can do anything that you want, and show source attribution if you want. If you click on it, it will not show. And then the other thing is you can go for the maximum contact items, number of relevant sources to include in the AI responses. And the other thing is we're still working on the settings to make sure that they become better for you. The display, it becomes better for you. Quiz auto advance, move to the next question automatically after answering. You can do that as well. Play sound, working on this so that it becomes something that you need. All right, so this is it for this video, guys, or for this tutorial on how to use the AI tutor. So for anything that you want to know or you want us to add on the AI tutor, just comment in the comments. Just give us a comment. Just give us an idea how you want it to be. If it's feasible, we'll do it. If it's not, I'm sorry, we can do it. But the thing is, I've heard people saying we should add a virtual patient that you guys can clack when you're home to practice your clacking skills, and then you have the AI to even mark for you. Please, if you like it, just tell us, we'll put it. Thank you. Ciao.